You know that feeling, right when you wake up, eyes barely open, feet not even on the floor yet, and there it is, that thick, stubborn lump sitting at the back of your throat. You swallow, figuring that'll take care of it, but nope. Give it a minute or two, and yep, right on schedule, it's back. Turns out your body's been doing that on purpose this whole time, day and night, whether you've ever noticed or not. Your nose, your throat, your whole airway, they're cranking out mucus around the clock. 1 to 2 quarts of it a day, and honestly, that's a good thing. It keeps everything from drying out. It humidifies the air on the way in, and it catches dust, viruses, bacteria, all of it, before any of that gets further than it should. Most days it just blends in with your saliva, and you swallow it down without giving it a second thought, same as you don't think about breathing. So if your body's always making this stuff, why does it suddenly feel like too much? Why does it pool up, or get thick, or just sit there no matter how many times you clear your throat? That's the part worth digging into. When your nose is the real source. Turns out that lump doesn't usually start in your throat at all. Most of the time, it's coming from your nose. When the lining up there makes more mucus than it needs to, that extra stuff collects in the back and slowly works its way down into your throat. The Cleveland Clinic actually has a name for this: postnasal drip, or upper airway cough syndrome if you want the fancier version. And it tends to feel exactly like that, a tickle or an itch sitting just out of reach, the kind you can't quite scratch no matter how hard you try. Now, what kicks it off can really vary. Allergies are a big one, what doctors call allergic rhinitis. But colds, flu, sinus infections, even something as simple as a deviated septum, they can all leave you with that same backed up feeling. And some triggers you might never connect to your throat at all. Dry air, a sudden cold front, spicy food. For some folks, even bright sunlight sets it off. There's also something worth keeping in mind. A few medications can play a role here too, including certain blood pressure pills and birth control. Of course, if this has been hanging around for a while, it's worth a quick mention next time you're at the doctor. Not because it's urgent, but because there's a long list of possible reasons, and they can help narrow down which one's yours. The good news, relief here is pretty easy to get your hands on. A saline nasal spray can thin that mucus out and help it drain the way it's supposed to, and it also tackles the dryness that tends to make everything worse. Drinking enough water matters more than most people realize. So does something as small as propping your head up a bit when you sleep. If allergies are the culprit, cutting down on what sets them off helps a lot. Things like running a vacuum with a HEPA filter, that's a high-efficiency particulate air filter, over your carpets and furniture, or pulling up rugs entirely if your allergies are bad enough. There's also plenty over-the-counter antihistamines like loratadine or cetirizine, decongestants like pseudoephedrine, and something to thin the mucus itself, guaifenesin, which you've probably seen on the shelf as Mucinex. But postnasal drip doesn't explain everything, not by a long shot. For some people, especially as the years go on, there's a totally different process at play, one most folks would never think to connect to their throat. The reflux you can't feel. The Cleveland Clinic says when most of us picture acid reflux, we think heartburn, that burning behind your chest after a big meal. But there's a version of reflux that skips that part entirely. It's called laryngopharyngeal reflux, LPR for short, and you'll often hear it called silent reflux, because for a lot of people, that's exactly what it is. No burn, no warning bell. Just stomach contents traveling further up than they should, reaching the throat, the voice box, even up into the sinuses, irritating everything along the way. Think of a sink with a slow drain. The water never overflows in some dramatic way. It just creeps back up bit by bit, so quietly that you don't notice until the counter's already damp. That's basically what's happening here. Something's backing up, and there's no siren to warn you about it. With regular acid reflux, GERD, that's gastroesophageal reflux disease, heartburn shows up in the huge majority of cases, well over 80%. But with LPR, heartburn only shows up in around 1 in 5 people. Meanwhile, that constant urge to clear your throat happens in roughly 87% of LPR cases, versus less than 5% with GERD. So if heartburn's never really been your thing, but throat clearing has, silent reflux deserves a much closer look than it usually gets. If you're over 60, this matters even more. Doctors estimate that more than half the people dealing with chronic hoarseness have laryngopharyngeal reflux involved somewhere in the picture. One study zeroed in on patients over 60, average age 67, and found that body weight, measured by body mass index, was strongly tied to abnormal readings on the gold standard reflux test. Now, this isn't medical advice, but if you've been stuck with that throat clearing, mucus in the throat feeling for ages and nothing else seems to explain it, silent reflux is worth bringing up at your next visit. Even if heartburn has never once been part of your story, a separate review found that in older adults, LPR and GERD often look more serious on examination than the person's actual symptoms would suggest. The exam tells a bigger story than the person feels day to day. It's a bit like a house with a small crack forming in the foundation. From where you're standing inside, everything seems fine, but an inspector would spot something that's been quietly building for a while. The encouraging part is, treatment here is well established. For both LPR and GERD, changes to diet and daily habits form the backbone of managing it, no matter your age. On the medication side, there's a class called proton pump inhibitors. Names you might recognize: omeprazole, lansoprazole, pantoprazole. These are the standard go-to for LPR. One thing worth knowing, LPR usually takes longer to respond than typical GERD does. So if things don't turn around overnight, that's completely normal. Not a sign it isn't working. A medication you're already taking. It throws a lot of people for a loop because it's not an illness at all. Plenty of people have been taking it for years without ever connecting it to that throat feeling. If you're on a blood pressure medication and the name ends in pril, lisinopril, enalapril, ramipril, that sort of thing, you're on what's called an ACE inhibitor, short for angiotensin converting enzyme inhibitor. These have been around since the early 1980s, and for good reason. They work well, and most people do just fine on them. But one well-documented side effect is a dry, nagging, tickly cough. And it's not some rare fluke either. It shows up in anywhere from about 4 to 35% of people taking these, depending on which study you look at. Here's why it happens. CE inhibitors affect a couple of natural compounds in your body, bradykinin and substance P. Those can irritate your airways, and that irritation is what creates that nagging tickle. The kind that makes you feel like you constantly need to clear something out. Now, technically, this cough tends to be dry rather than full of mucus, but the feeling in your throat can be remarkably similar. Think of a smoke detector going off because of shower steam. There's no actual fire, but your body reacts like there is one anyway. Research points to people over 65, plus anyone on cholesterol-lowering medication, as more likely to run into this particular side effect. So if you've been on blood pressure medication for years, and AARP notes this throat thing often starts around that same time, or honestly even much later, that timing might not be a coincidence at all. The reassuring part, this is very manageable. The cough can show up right after starting the medication, or it might not appear for months. And if it does turn out to be the cause, it typically clears up within 1 to 4 weeks of stopping, sometimes up to 3 months. But, and this matters, never stop a blood pressure medication on your own. Your doctor knows your full history, and if an ACE inhibitor turns out to be the culprit, there's usually a close cousin called an ARB, angiotensin receptor blocker, that does the same job for your blood pressure without dragging that side effect along. When swallowing itself changes. There's one more piece here, and it's about something most of us never give a second thought to: the simple act of swallowing. As we get older, swallowing can get a little less efficient. Changes in muscle, in how the nerves time everything, less saliva, dry mouth from certain medications, all of it can play a part. And when that happens, your body has a harder time doing what it normally does without you ever noticing, quietly clearing mucus down the back of your throat along with your saliva. Research suggests somewhere between roughly 1/4 and almost 40% of older adults living on their own deal with some version of this. And in a study of adults over 65 living in their communities, more than half said they dealt with some kind of dry mouth. Here's something that might genuinely catch you off guard. There's this idea floating around that getting older just naturally dries up your saliva. But research reviewed by the National Institutes of Health doesn't really support that. The actual decline tied to age alone is small. Most of the time, dry mouth in older adults comes down to medication side effects, not age itself, which is actually good news because it means there's often something that can be done about it rather than just living with it. If dry mouth is part of what you're dealing with, there's real help available. Oral moisturizers and lubricants, artificial saliva products, even something as simple as a humidifier running by the bed at night can make a real difference. Drinking fluids while you eat helps too, especially with dry or rough foods. And sugar-free gum or mints can get your own saliva flowing again, as long as your salivary glands still have some life left in them. And for most people, they do. Bringing it all together, so where does that leave you if this mucus in the throat thing shows up more days than not? Honestly, there isn't one tidy answer, and that's actually useful to know, not frustrating. A lot of people trace it back to postnasal drip, often from allergies or just plain dryness, and that tends to respond well to saline sprays, staying hydrated, and cutting down on whatever's setting it off. But if heartburn's never really been part of your picture, silent reflux might be quietly running the show, and that's something your doctor can help confirm and treat, even if it takes a little time to feel the difference. Then again, maybe a blood pressure medication you've been on for years has had this one side effect tagging along the whole time without you knowing. Or maybe it just comes down to how swallowing itself has shifted, which usually has more to do with medication than with age, meaning there's more room to turn things around than you might expect. What ties it all together is this: none of these are things you just have to live with forever. Every single one of them has a real path toward feeling better, whether that's a small change in habit, a conversation about a medication, or tackling dryness head-on. The first step is simply realizing this feeling has a reason behind it, and odds are that reason is sitting somewhere on this list. Keep well, stay healthy, and I'll see you in the next video.